Had an 8-year relationship with him. When I first met him, I had a high sugar count, and I mean the guy's just incredible. But Dr. Bragman, this is your show, and we're doing this podcast. This is our first pilot, just letting you know. But would you tell us about yourself and your credentials and why you're doing this?
Well, I wanted to have major impact, beyond your own practice. And then the beauty of the internet is where you take ownership and you can have a vast number of people see you as opposed to just me being one-on-one in the office. My background, I've been in practice privately since September 6, '89 for going on 32 years. I am board certified in internal medicine, geriatrics, and primary care sports medicine. I'm a full clinical professor at the Wayne State University School of Medicine. I've been teaching Wayne State med students for around 30 years. I'm an associate professor at Michigan State College of Osteopathic Medicine, which is my alma mater. And I teach numerous nurse practitioner students everywhere from University of Detroit, Wayne State, Chamberlain School in Chicago, the Simmons School in Boston, and University of South Alabama. So they kind of find me, and we have developed relationships with those schools.
Well, I tell you what, that's impressive. I didn't know you were so esteemed. But as we do this thing right here, just primarily this right here is for men, and we're talking about male health. Whether you're a Black American male, which is we have the highest mortality rate.
Absolutely.
And speaking in regards to strokes and hypertension, but could you tell me in this environment, why don't you think black men, and why do black men need to come to see their primary care physicians? Because when you look at New Orleans, black people are 12% of the state population and 70% of the deaths. Chicago, Detroit, etc. Would you just explain to me why it's important for men, not just black men, to come see their health providers?
It's called taking ownership of your health. So many things are preventable if you eat well, if you take care of blood pressure, if you have the misfortune of doing that, if you have diabetes, if you're obese, if you're not exercising. These are things you have total control over. All it takes is a little bit of responsibility, a little bit of humility, show up to your physician, develop a relationship, let him or her give you some guidelines, and you can live a long, productive life.
In your practice, Alabama, Massachusetts, Michigan State, and my Michigan fans, don't get mad at me. I mean, I know we guys, he's a state guy. He let me know that when I first met him. But could you tell me...
No animosity towards Ann Arbor.
What are some of the big things you see with men that we can prevent? Even myself, I didn't come to a doctor until I was 50 years old. And thank God I got here because I was able to get things. But what do you see that men who come in here to see that we need to address?
Especially in the African American population, prostate cancer is at the forefront because for some apparent genetic reasons, we know that the prostate cancer tends to be somewhat more aggressive. So you need the screening, you need to be seen, you need to have an exam, you need to have blood tests, and do the follow-up. If you have the misfortune of having something, you do the proper consultation and follow-up so you can get a handle on it.
Okay. Let me ask you, we're going to pivot to the next question. They call it the silent killer. Hypertension in males, and particularly black males, and toxic stress. Would you expand on that for us?
Hypertension is known as the silent killer. Why? The number one symptom of hypertension, high blood pressure, is no symptoms. When people do have symptoms, the number one symptom is fatigue.
Okay.
In today's climate and environment, everybody's tired, they're fatigued. How the hell do you know whether it's is it blood pressure? Is it from the stress? We're in a COVID pandemic right now. And then if the high blood pressure is more severe, then you're dealing with headaches and blurry vision and shortness of breath and chest pain. So there's a wide spectrum of disease of symptoms that you have to check up on.
Okay, and now explain this. I have a friend of mine, a very active guy. We work out at the gym. But he came about with a stroke, and right now his whole left side is paralyzed. I mean, it seemed like a board of health. Could you give us some preventative measures to reduce this?
Number one, it's a sensitive subject because my late mom had a catastrophic stroke and was in a nursing home for 12 years. So I'm very, very attuned to what can happen. But what are you're really asking me? What are the symptoms, or what are the predisposing factors towards a stroke?
Yes, because our audience want to know. I mean, I want you guys to know that as we do this pilot, it's going to be in Israel, it's going to be in Brooklyn, it's going to be in LA, going to be all over. So you are telling us. I didn't know your mother passed with a stroke, was in a nursing home for 12 years. But could you tell us some preventative measures that we can help our audience? That's what we hear.
At the top of the list, smoking, number one. Obviously, high blood pressure, untendered, is huge. Diabetes, if you have that, is a huge risk factor. High cholesterol. Is there a family history at all? Does a person have what we call the autoimmune diseases, the inflammatory diseases, where the body engages in friendly fire against itself? It has a slight predisposition towards strokes in some conditions. Lack of exercise and obesity. These are the big numbers that we're looking for.
Okay, so tell me, what is a healthy blood pressure range for a healthy citizen that's 50 years old?
For 50-year-old, we like it 120 over 80. The upper limits that they're allowing right now are 130 over 90, but we're lowering it more and more. So ideally, you'd want to be anywhere from 100 to 110, 120 over 70 to 80 would be an ideal. Okay,
so let's pivot back to the coronavirus. The same thing you told me with the hypertension. I want to say acquaintances, as well as a couple of good friends, parents who have passed. Why do you think this thing is ravaging Black America?
A number of reasons. Everything that you read about in the Black culture, there was less until Mayor Mike Duggan in Detroit, in our home city, really emphasized hunkering down and having some social distancing. That was one issue. Number two is the access to doctors. For Black men going into their doctor's office has been somewhat remiss. Access to health care, proper treatment of hypertension and diabetes and asthma is at the forefront as well. And often there's a higher incidence of obesity and a lack of exercise. So these are the major risk factors that we're seeing.
So okay, and let's talk about in the Jewish Orthodox in Oak Park and Southfield, as well as New York City. They're dying at phenomenal rates too. How can we prevent that?
The Jewish Orthodox that we had a high number of cases in Oak Park, Michigan, was people were going to the synagogue, to shul on Saturday like they normally would. They were not doing it virtual like a lot of churches and synagogues and mosques were doing. So they were late to the game, and they paid a price for it. And there tends to be a larger family structure with them. So it's very common to see 5, 6, 7, 8 kids within that structure in the Orthodox section of Oak Park and places like Crown Heights, New York.
So Crown Heights, New York. It's another city in New York, because I work on Wall Street, and like in the Connecticut, the White Plains area, but they shut that down. It's non-existent. But when you go back down to Queens and Brooklyn, and what about the jails? I mean, the federal prisons. I mean, explain that one.
Jail's been running rampant because, number one, they're in close quarters, of course, so the proximity to the various prisoners. Number two, a lot of incidents of alcoholism and drug use and smoking within the jail system, so their immune systems probably aren't the greatest to begin with. And there, by definition, there's no social distancing. The diets are, and the prison food is not exactly going to win any James Beard Awards for.
Okay.
And is it going to be necessary to be the healthiest, vegan type diets, which bolster the immune system? I'm sure not.
Okay, and now since we're in Michigan, and there's something, there's two things: the Flint water crisis and the lead in the brain. Explain the long-term effect, as well as what do you see in your practice when you see the lead on the body and the lead on the brain and kidneys?
The lead is sad because lead causes, especially from a young age, it causes delayed neurological development, brain development, cognitive development. So people run the risk of not reaching, their maximal academic potential because their IQ is limited by virtue of the exposure. specific. That's on the brain level, and it also can cause what we call a peripheral neuropathy, chronic numbness and tingling in the hands and feet. The kidneys, it causes a problem. The filtering part of the kidney we call the interstitium, and it can cause chronic kidney problems down the road. And it can even cause various and sundry anemias or low blood counts because of the exposure to lead.
Okay, so here, I guess here's a novice, and Dr. Bragman, I just want to just let you know, he is a man who's dedicated to public health, as well as his passion and his candor. We had a conversation. My cholesterol was high, and most black men, we like fried chicken. I cut the fried chicken out, so he told me I got that range down. But we always joke about this here. Why do women outlive men by 10 years in this country?
Women, for whether it's the estrogen, the average woman lives 7 years longer than the average guy. There's also, I think, women, because of childbirth, they're often coping mechanisms, although they complain, they seem to be somewhat mentally tougher as well. The incidence of heart disease and diabetes postmenopausal when starts approaching, but there's more early deaths in males than female. The curve evens out. Once you get to 75, 80 years of age, it's not such a huge disparity, but to get to that point.
Well, my mother should probably get mad at me. She's 79 years old. She lives in a senior living place in Ecorse. And the crazy part about it, out of 200 people, there's 190 women and 10 men, and all the women I know as a little boy, and their husbands is dead. So explain the phenomenon. What is going on? I mean, this is crazy. And it's a mixed community. Ecorse is a mixed community. So explain that one. I mean, why are they living so long? You gave us the estrogen, and to some people who don't understand that, but is there other factors?
Genetically, I've never seen a spectacular. It's all conjecture and theory. Are women exercising more at that age necessarily? Not necessarily. Are people? Do they have less diabetes, obesity? Than men. It's one of those actuarial things we know exist. I don't know if we have a great answer, because 7 years is a substantial amount of time. Of a disparity in the two cultures.
I tell you what, Dr. Bragman, he's a very athletic, racquetball champ, squash champ. Son plays squash. But anyway, we want to talk about genes and how, like, the Peyton Manning, Archie Manning, Joe Bryant, Kobe Bryant, Michael Thompson, his son Klay Thompson, Rick Barry. So explain, how does genes affect us physically as well as?
It's a great question. Genetics. Let's start with sports. I mean, clearly there's a number of reasons. Rick Barry had 2-3 sons. Michael Thompson's was really, really good, and his son's probably where the kids. Even Andre Agassi, in one of my sports tennis, his son. He's married to Steffi Graf. Their son, they did not want him playing tennis because of the pressure. But they do know that they want him to. He's a star in baseball. Yannick Noah's son became a star NBA player with the Chicago Bulls. Joakim Noah. So it's a combination of genetics. You do have some greater. We call the fast twitch fibers, which allow you to be a little bit quicker. Or do you have endurance genes? Some people are genetically born with that. But certainly when you have a mentorship, when you have a father, you have a Joe Bryant with Kobe, when you have
Mario Andretti.
Mario Andretti, pass it on to Michael and Andretti. I mean, clearly the father knows the formula for success. The mental toughness you need to do, the mental training that you have to do is instrumental. So it's a great advantage to have Ken Griffey's father. Ken Griffey Jr. His father was a hell of a ball player for Cincinnati and World Series champs, and the son ends up in the Hall of Fame.
Kiki Vandeweghe, Kelly Tripucka.
All these guys have rich things.
So how do we take? And I know, man, we want sports, right?
Right. But how do we do this with academics?
Genetically as well as genotype, scientifically, medical. So how are some of these physical traits passed on to different generations, like in the Jewish community and the Tay-Sachs disease.
Tay-Sachs and
so
Gaucher's disease.
Explain it.
Genetically, you have a greater predisposition towards certain diseases. That's genetics. That passes on. Some diseases, sickle cell is a dominantly passed trait. BRCA1, the gene is involved in breast cancer and ovarian cancer, is more common in Ashkenazi, Eastern European Jewish population. Certain diseases,
like sickle cell and
thalassemia is an anemia that's what's called a Mediterranean anemia. It's very prevalent in Greek, Chaldean communities as well as.
Explain it. I've never heard of that one.
It's a mild anemia that is within those populations. The hemoglobin gene, what's called the beta gene, doesn't produce as much, and you're going to be chronically anemic, but that one doesn't require transfusion. Sickle cell is a little different because, of course, it has been deadly. It causes all kinds of hemolytic problems where the red cells destroy themselves. You see examples where people get blood clots in the lung that we call pulmonary emboli. You see severe pain crises and syndromes within that population. We're starting to develop some real good treatments finally after so many years. So that's science catching up to the disease, the actual disease state.
And to our viewing audience, I want you to know this is a real, authentic doctor, not a doctor who got his degree on the internet. You see his credentials in the back, James Bragman out of West Bloomfield. But let me just ask you another question as it relates to the alveoluses of the lungs. And we look at Shreveport, Louisiana, and we look at Detroit, Southwest Detroit with the factories and Zug Islands. You look at all the people with the asthma. Explain how does that affect us as men long term? Because a lot of men work in those factories and they have all type of respiratory problems. Would you explain how to prevent some of that?
The gas exchange units of the lung, the fancy term is called alveoli. These are the cells that
explain it to our audience because
and
most of
the alveoli are the gas exchange. So that means when you take in a deep breath, you breathe in oxygen, you blow off carbon dioxide. So that is, the lung is kind of like a pillow. You take a deep breath in, you exhale, and you have a normal process. If the lungs become damaged, it becomes more difficult to exhale. Or sometimes if you have certain diseases like in foundries and factories, you may not get a complete deep breath. Now, certainly, it's enough of a disadvantage to be in those factories, but if you smoke on top of it, now you're really setting yourself for potential disaster years down the road.
Okay. Now, in Michigan, they legalized marijuana. I know people are very, very, very particular about somebody telling them, we don't judge you. We just want to just give you the scientific fact about the effects of marijuana on the brain, of marijuana on the lungs in the long term from a real doctor. So would you explain? You see all the young kids, they just think it's just really great. We're in the middle of the pandemic. You go to any marijuana store, it's a line like Costco. Could you explain the negative effects of smoking marijuana?
What does marijuana do on a chronic daily basis, potentially? They talk about amotivational syndrome. Amotivational means you just don't have any fire and get up and go to get your activities done during the day. Yes, it can relax you. There are people who come to me, I can't sleep, it relaxes me. I want to use this instead of alcohol. That's the argument. But what does it do long range to your brain? Are you still knocking off brain cells? The answer is yes. What is the stuff mixed with? What is it doing to your lungs is a big question you have. Can it have toxic, irritable, inimical effects on the lungs? The answer is yes. Most really young people, how many can really say, I have such severe pain syndromes that I really need marijuana? It's used, in my opinion, as a crutch for people who need to develop better coping mechanisms to deal with life's day-to-day stresses.
Okay, so that's the mental. I call all addictions like escapism, but let's just get back to marijuana.
Sure.
I look at the young kids. I'm a retired high school principal. You can pull it up. Kenneth McFall, went to Harvard, Wayne State, Eastern Michigan, Bismarck, all that. Studied at Sorbonne in Paris. But here's the big question to you. how does it affect a kid before you get to 25? I'm talking about as far as the respiratory system. And the second part of that question, that question, I know a lot of kids, they smoke weed like me and you used to drink a Fago. So what are the damaging effects down the road?
Well, what's not being discussed, I'm going to use a bridge in this COVID crisis. Why, one of the questions I get asked commonly, what's happening? Why are young people ending on respirators? And the one thing that's not, there's no data and statistics, if you whatever you watch, MSNBC, CNN, Fox, whatever your persuasion, they're not discussing how much vaping is going on and how much marijuana is being consumed by young people.
Oh, that's a whole nother conversation.
Because what does vaping do to the lungs? We've already seen one of the landmark cases was the young teenager who ended up at Henry Ford Hospital and ended up with a lung transplant. He's the worst of the worst. But even with this coronavirus, how many people are vaping? I've not seen any data. I have a strong suspicion, in talking to some of my colleagues in infectious disease who are on the forefront at places like Beaumont Hospital and Henry Ford Hospital in Detroit, there's a high incidence of vaping going on.
Yeah, and let me say this here. This is a free public announcement for the parents. Me, myself, I get mad at my assistant principal. Kids are vaping in your face. They have a computer drive. They look like a phone. So parents, you got to watch your kids.
Absolutely.
Vaping, I don't know what the scientific, but that's the new cigarette. High school
It's an
kids.
e-cigarette. It's all it is. It's an e-cigarette. It's and the theory is it's less nicotine, but the contrapoint to that is, are people taking deeper inhalations because it's an e-cigarette, because there's no less tar and nicotine. So it's certainly not harmless and it's not innocuous. That's a fallacy.
So what does nicotine do to the body? I see the guys, the baseball guys, all of them have mouth cancer. So explain, what is the vaping nicotine doing to our kids all over the country? It's ravaging.
It's ravaging the people who vape a lot. You have a higher incidence of heart disease, lung cancer, of course, oral cancers, esophageal swallowing cancers, pancreatic cancer. It has devastating. The nicotine is an addictive substance. My late father, 67 years of Winston's, and that was his only addiction, but tried to quit 1,000,000 times. Life insurance business of all things, so understands the actuarial and but that was his one weakness. And
Okay, and the last segment. This is a world-class squash player. For those who like squash, I'm not gonna say I was a world-class basketball player, but I was able to get a scholarship. But could you give the men, what should we do in our 50s, late 50s, early 60s to continue to compete at a recreational level and to continue to improve our health? Could you give us what does squash do to you?
For squash and tennis are my two beloved ones. I played tennis at Wayne State University in undergrad, and squash is it's good mentally because it clears your head. You have to make a lot of quick decisions. Now, your ability, they have age groups. The one thing in all these sports, you have to understand, you can play with 20-year-olds, but they're quicker and they're going to be a little bit stronger, but they have age groups, and you have a sport for a lifetime that's going to keep you healthy and fit. Kenny's sport in basketball is a tough one. In the history of my practice, I have had only one person ever play competitively into the 60s. This person's a former patient who was on the bench for the University of Michigan a long time ago, but I only have had a few people in their 50s that play in church or pick up games, actual leagues in their 50s.
Well, hold on, Doc. I still play. I'm 59.
You're an exception. You're about the fourth in the history of practice that can still get up and down a court and have their joints.
I'm not going to play with the 22-year-old boys.
But if you play in a league, even over 30 or over 40, whatever it is, you're an exception rather than the rule and play competitively.
So I guess
it's a tough game on the body.
Listen, those of you who watch this is a 8-year friend, and I consider him a friend. And I'm gonna tell you a couple little caveats. We want to improve your health all over the country, all over the world. And one thing, what really make this guy a special guy to me, I had a shoulder injury about a year ago, and I went to the local hospital, Henry Ford. They gave me some Motrin 800. I was drinking them and eating them like lifesavers.
I remember that, yeah.
And I had to endure the pain. Went to Nova Healthcare in the back. Went through therapy for about 4 months. I'm good. And he doesn't just give you all these medicines. He give you stuff that help you out. And we're not endorsing his business, but if you need a primary care doctor, call James Braggerman. But not just that. Check us out as our next one. We're going to sign off, and we're going to sign off with good health. Tell them.
We're going to sign off with good health, and in some future segments, we're going to discuss about good health is understanding the mechanics in sports. It's the biomechanics. Why is a person having injury? How do we correct it? What can we do or alter it? When it comes to diseases, I believe very often we can control our own destiny. I'm a big believer. So whether it's through reading, whether it's through exercise, whether it's through meditation, relaxation, that's what at these future podcasts we're going to be emphasizing, and I want the public to take control. And I'm going to sign off with one last piece. And with this coronavirus, one thing which is disturbing to me, which is not discussed. So if you're watching, I've said to Kenny, if you're watching CNN, Don Lemon, the first 10, 15 minutes of his program is bashing Donald Trump. If you watch Fox, you've got Sean Hannity making $36 million a year being a shill for Trump. I want to see people, what can you do to bolster your immune system? So if you're out there and you're living in fear, which a lot of people are, what can you do? You can get an extra hour of sleep. You can meditate. You can get your exercise. You can keep in contact with your friends with FaceTime or Zoom or what have you. And you're going to live a much more healthy, happy, productive life.
Listen, we're going to sign off. Pass this to 10 of your friends. Ladies, don't get mad at us. We're primarily focused on men. Ladies, we're going to work with you, but give this to your husband, and happy Mother's Day to the ladies, and have a good one. We'll see you next time.
Happy Mother's Day, guys.